as I was saying, one night in May 2010, I was having a conversation with my friend and neighbor, David Morse, the actor, about something he had witnessed on television that left him very disturbed. He saw his friend Sean Penn searching for medical care for a young boy dying of diphtheria in the earthquake-ravaged Haiti. And David Morse asked me, how is it in this day and age that anybody, any child, can die from a disease that's easily prevented by a vaccine? Well, the sad fact is that it's not just one child. It's actually millions of children. Some estimates as many as 3 million children a year die from diseases that you can easily prevent by a vaccine, kids under the age of 5. So here are some numbers. So 500,000 children dying of pneumococcal pneumonia, 500,000 children dying of diarrheal diseases, rotavirus, about another 500,000 kids dying of measles, tetanus, pertussis, Haemophilus influenza. These deaths are unacceptable. These deaths are absolutely unacceptable. So what's the problem? Vaccines have to be kept cold. I have a vaccine here that I took from my clinic in Philadelphia yesterday. It's been in my pocket for a day and a half. This vaccine is useless. Why? Because vaccines have to be kept cold. They have to be kept between 2 degrees and 8 degrees Celsius, or about 36 to 46 degrees Fahrenheit. If they heat up, they denature and they get inactivated. If they freeze and thaw, they break down and they're no good anymore. So from the minute that vaccine leaves the manufacturer's office, the manufacturer's factory, to the time it gets to the child in the most remote parts of the world, that vaccine has to be kept between 2 and 8 degrees Celsius. We call that the cold chain. And here are some pictures of what a cold chain might look like. It gets to the main distribution center in a developing country, and it could sit in that distribution center for a very long time. Finally, it gets on the back of a bicycle rider or a motorcycle rider, bringing it out to a very distributed, remote place in their country. And then maybe the last mile literally is delivered by a camel. So this is the cold chain. When you go to your pediatrician, the pediatrician reaches into the refrigerator and your vaccine is kept nice and cold. This doesn't happen in the developing world. And so the problem is very simple. Vaccines save lives, but they also have a tremendous social, economic, political, and even moral impact. So you vaccinate a child, you keep that child healthy, you empower women. You vaccinate a child, you keep the child healthy, and you unburden the totally financially burdened healthcare system in the developing world. You vaccinate a child and you keep the child healthy, you decrease the amount of antibiotic-resistant bacteria out in the community. You vaccinate a child, you keep that child healthy. When you travel to the developing world, you will be more safe. You vaccinate a child and you keep that child healthy. Some would even argue, as this World Health Organization article does, some would even argue that you increase cooperativity between nations and you actually enhance world peace. So that's just an amazing impact of vaccines. We save lives, but we have all these other impacts. So what's the problem? There's the logical proposition. Vaccines are important. They keep kids alive. They have this great economic impact. You got to keep vaccines cold. So just plug the damn refrigerator into the outlet and get going. What's the problem? Why are 3 million children dying when you can just plug the vaccine refrigerator into the outlet? The problem is there's no outlet. There is energy poverty around the world. About 3.5 billion people lack access to adequate electricity. That's more than half the population of this globe. So energy poverty is a main problem. There are no outlets to plug vaccine refrigerators into. So how do we solve that problem? Well, did you know that in fact there are more cell phones in the world than there are toothbrushes? There are more cell phones in the world than there are toilet bowls. And the cell phone industry is growing exponentially in the developing world. Everybody says now within the next 10 years, there will be complete coverage of the world with cell phones. Some people even have more than 1 or 2 cell phones. There's no landlines in the developing world. So how do you think cell phones work? They work by electrons, right? Electricity. So where's the electricity coming from? It's coming from cell towers. Everywhere, who's been overseas? Who's not had access to a cell phone? You always have access, well, maybe once in a while. You generally always have access to cell power. That cell tower company has every incentive to keep the power on. If they lose power, they lose customers. They lose customers, they lose money. The ministries of health, the public sector, has every incentive to expand vaccine coverage. So make a public-private partnership between the mobile phone industry and the ministries of health and just co-locate the refrigerator with the cell tower. There's plenty of power at those cell tower sites. Trust me, plenty of power. Doesn't take much to run a vaccine refrigerator. And guess what? The solution to this problem is sustainable, it's scalable because it's going to scale with the mobile phone industry, it's locally managed because it's the folks on the ground who are managing it, and we can use the connectivity, the communications that the cell tower industry allows to monitor those vaccine refrigerators so nothing goes wrong with the technology. And so this solution is elegant and simple. And that's a picture actually of one of our sites in Zimbabwe. So what does an academic do when he thinks he's solved this big problem? We write a paper. And so we wrote this paper exactly 4 years ago. It came out in the New Scientist in September 2010, just suggesting this solution. Co-locate vaccine refrigerators with the mobile phone industry cell towers in the most remote parts of the world, and you've solved that cold chain problem. The cold chain breaks down when it gets very remote. It's not so much the intermediate steps, but it's really when you get out there. So, but as I said, there are cell towers everywhere. So just co-locate it. And I want you to take a look at that cartoon that the New Scientist drew as part of the article. So that's what we suggested. When that article came out, we were invited basically all over the world to give talks about this. And I gave a talk in Mombasa in Kenya, and sitting in the audience was a senior engineer from Econet Wireless, which is the major cell phone operator in Zimbabwe and other parts of Africa. And he said, Bernard Fernandez said to me later, this is something we can do. This is something we have to do. This is our corporate social responsibility. We want to contribute to giving good, adequate health care to the people in Zimbabwe. And you know what? He went out and did it. And that's a picture of one of our sites in Zimbabwe. The refrigerator is sitting right next to the cell tower. It's using that energy at the cell tower to power up the refrigerator. And we now have 111 sites in Zimbabwe. We're building another 58 sites in Zimbabwe. We have plans for another 100 sites after that. And it is absolutely a remarkable, literally within the space of 2 years. We've gone out and vaccinated lots and lots of kids, and I'll tell you how many in a moment. Everywhere you see an H on that map, that's one of our sites. We have software that you can click on that H, and a screen opens up, and I can tell you exactly how many times that refrigerator door was open. I can tell you what the internal temperature of that refrigerator was to make sure it stayed between 2 and 8 degrees. I can tell you what the ambient temperature is around the refrigerator, and I can tell you even if the door stayed open. Wouldn't that be great if you had that in your own refrigerator? Honey, did I close the refrigerator door when we left it? So we can, and if that happens, we send a message back to the locally managed group, and they say, go check that refrigerator door. So this is how we do it. We assess the sites. We have very careful GIS mapping of where the cell towers are and where the health clinics are. We then do an optimization program of how many miles or kilometers does it take to go and deliver vaccines and then deliver it to the local community. Once we do that, we start building the shelter, the vaccine shelter itself. That's enclosed within the cell tower footprint. So security is already built in because, trust me, the mobile phone industry likes to protect what they've built. After we build the shelter, we stock it with these special refrigerators that have this mobile and remote sensing. We do that, we stock it up, we inspect it, and then finally, in the last slide, we turn it over to the local managers. So that's our strategy. But as I said, we also remotely detect anything that might go wrong with the technology. So we have an operations center, or actually Econet, the mobile phone industry, has this operations center where they're continuously monitoring the status of the cell tower. They need to know if the electricity is okay. They need to know if they're beaming out the right kinds of information. So we've just piggybacked on top of that with our own technology built into the refrigerators that send messages back to the operations center. Somebody is monitoring it 24 hours a day. If something goes wrong, text message, SMS message, email goes to the local managers, go fix what's wrong. If there's something that's really hard to fix, we have these little boxes that we can keep the vaccines cold. because trust me, the last thing you want to do is have this thing sit in somebody's pocket for 24 hours. So that's been really remarkable. That's actually very unique. I'm going to show you a video that somebody sent me from South Africa. Just take 1 minute and watch this.
Life was not always like this. We were losing a lot of babies. A simple vaccine was all that was needed to save their young lives. But the vaccines needed to be kept cold, from 2 to 8 degrees Celsius, against our African heat. We had to throw away lots of these, and it was such a challenge. Then Econet, through its Energize the Chain program, installed close proximity refrigerated containers. These simply use the excess power from the wireless base stations. Now, we don't have to worry about that anymore.
By creating innovative solutions, Econet Wireless is promoting community transformation and joins the fight against the top 5 child killer diseases. Econet Wireless, inspired to change your world.
Thank you. So right now we're in parts of Zimbabwe. Last year, we vaccinated 250,000 children. We're building it out. We're going to finish our build out in Zimbabwe. We're going to move to Lesotho and Burundi. We're going to vaccinate another 250,000 children. And in the following years, we're going to go to the rest of sub-Saharan Africa, and hopefully by the end of 2016, we'll be up to 1 million children. But there are other parts of the world too. So we have a program in India. My student Alice Conan, who wrote that first paper with me, is on a Fulbright scholarship in Karnataka right now, in Bangalore, setting us up to build it out in that part of the world. We have 5 health centers. There are only 15,000 kids that we're going to service, but it's a beginning to get going in India. And that's really we'll have lots of business to do and lots of work to do in India. So this is a picture of Alice at a vaccination center. Does it look like you're a pediatrician? I don't think so, but that's the challenge. And so I'm going to share now something that I've not shared with anybody else yet, only with my 800 of my closest friends. And so here's some new ideas. So as we solve this problem with the cold chain, we start thinking about other problems that are associated with it. We're going to have millions of kids that we're going to vaccinate. How do you keep track of 1 million kids, 10 million kids? So we call that infant biometrics. Right now, you're an adult and you put your fingerprint down, they do a retinal scan, that's terrific. Fingerprints and retinal scans don't work for infants. So we need a new technology. We call this Energize the Chain Labs, or High Impact Technology Solutions, HITS. So one of the things we're going to start working on is infant biometrics. It's a brand new field. It's going to take some really clever engineers. So then we have lots and lots of information, lots and lots of data for these kids. How do you create a database that's safe and secure and can't be messed with? And how do you query that database? So these are kids that are coming. They may be refugee kids, they may be migrant kids, nomad kids. So how do you keep track of them and say, you're due for your next vaccine? So we call that process differential privacy. And trust me, that happens. We need that in our financial sector. We need that in your own electronic medical records. So we have engineers thinking about algorithms that would assure differential privacy. Then, what's in the refrigerator? How do we do real-time inventory? The last thing you want to have a healthcare worker do is schlep out a whole bunch of vaccine that doesn't need it in the refrigerator because it hasn't been used yet. Or forget to bring the polio vaccine because they didn't know it was out of stock. So we need to do real-time inventory. For a single-dose vaccine like this, it's relatively easy. There's all sorts of technology. But a multi-dose vial where you're taking out a half a cc, how do you know what's left in that vaccine? So real-time inventory is a very interesting problem, something UNICEF is very interested in solving. We're going to start thinking about that. And then finally, if we know exactly who's out there, and we know exactly what kinds of vaccines we have to bring, and we can query it very, very safely and securely, is it possible to actually deliver these vaccines to these remote sites using autonomous vehicles? So we don't worry about anything, putting anybody in danger of going to these remote areas. Just have your autonomous vehicle deliver it. So these are 4 ideas we're working on in Energize the Chain Labs that we're going to start working on. And so it's not a secret. I'm inviting all of you to start thinking about this. Now, you know, the bottom line is that it's not just me, of course, it's a whole team we've put together. And from the Wharton School, Kent Smetters is an old dear friend of mine who's a professor at Wharton. He's been there from the beginning with us. We have Arvind Menon, who's going to be going to South Africa to head up our health impact. Are we really impacting health when we put this solution in place? We have Alice Conant, who's setting us up in India. We have Precious Lunga and Mayur Patel, who are at Econet, help giving us advice. I have Judah Levine, who's an energy expert, an independent consultant, who's giving us advice. We have Nick Seidel, who's taking care of all the legal aspects. So we have a really, really terrific team. We also have a terrific partner in Accenture Development Partnerships. We have David Taylor, and we have Shilpi, who really have great experience in this. So the point of this is that it's not just one person, it's an entire community of diverse folks who are worried about this problem. 3 million lives. The bottom line is, Tower Power can save lives. Thank you.